Trump's tit-for-tat tariffs on India looming next month, millions of Americans may have to brace for the steeper medical bills. Last week, the Indian Commerce Minister Piyush Goyal made an unscheduled trip to the United States for discussion with the officials hoping to strike a trade deal. It followed Trump's announcement that he would also impose tariffs, which are government taxes on foreign imports on India by 2nd April in retaliation to India's tariff on American goods. Goyal wants to stave off the tax increases on the India's critical export industries like the medicinal drugs. Nearly half of the medicines taken in the United States come from India alone. Generic drugs that are cheaper version of the brand name medications imported from the countries like India make up 9% of the 10 subscription that is in the United States. This saved Washington billions in healthcare cost. In 2022 alone, the savings from Indian generic amounted to a staggering $219 billion according to a study by consulting firm IQVIA. Also, without a trade deal, Trump's tariff could also make some Indian generic unavailable, with the forcing companies to exit part of the markets and exacerbating the existing drug shortages, expert says. The tariffs could also worsen the demand-supplies imbalances and the uninsured and the poor that will be left counting the costs, Dr. Melissa says, and who is also a drug costing expert from the Yale University. The effect could be felt across people suffering from a range of health conditions. Over 60% of the prescription for the hypertension and mental health ailments that is in the United States were filled with the Indian-made drugs, according to the IQVIA study funded by the Indian Pharmaceutical Alliance. That is, sertraline, that is the most prescribed antidepressant in the United States, is a prominent example of how dependent Americans are on the Indian supply for essential drugs. Many of them cost half as much as of those of the non-Indian companies. We are worried about this, says Peter Maybarduk, a lawyer at the Public Citizen, a consumer advocacy group fighting for access to medicines. 1 in 4 American patients already fail to take medicines due to their cost. He adds, Trump is already reportedly facing pressure from the United States hospital and generic drug makers because of this tariff on the Chinese imports. The raw material for 87% of drugs sold in the United States are located outside the country and primarily concentrated in the China, which fulfills around 40% of the global supply. With tariffs on Chinese imports rising 20% since the Trump took office, the cost of raw material for drugs have already